Hello, I'm John LaRosa, president of Marketdata Enterprises, a Tampa market research and consulting firm. Welcome to Marketdata's Weight Loss Market Teleseminar. I hope you get a lot of value out of this teleseminar. It's one of many that I'll be doing on a variety of weight loss market topics. We cover more topics about the weight loss market than anyone. And after looking at the PowerPoint presentation that will follow, you're welcome to email me or contact me by phone with any of your questions about any of the material. So why, as Marketdata and myself, why are we experts in the weight loss market? Well, for a variety of reasons. First of all, there is no trade association representing the industry on a national basis. It's really unbelievable that a $60 billion industry that's so huge and so vast and has so many different segments to it doesn't have a trade association. Just about every other business in the country has a trade association representing them, but not the weight loss market. In addition, it doesn't have a magazine or a trade journal regularly covering developments in this market. So we and other market research firms are some of the only sources of objective, unbiased analysis about weight loss companies and the market. Also, Marketdata has tracked this market longer than anyone. We were the first ones to quantify the size of the market in 1989. We've been tracking it every day for 25 years since then. I personally have researched and authored more than 50 market research studies about various segments of the market. 50 in-depth market studies. Plus, we cover all 10 segments of the market, not just a few, not just diet drugs or diet products, but all 10 segments. No other firms do that. We have contacts with former employees that used to work for weight loss companies that now can share information that they couldn't share when they were employed by those companies. We speak to franchisees and former franchise owners. We speak to reporters, writers, Wall Street stock analysts, MDs, physicians, startups, entrepreneurs. This is my passion. This is almost like a hobby to me. It doesn't even feel like work. It's a fascinating, dynamic market filled with entrepreneurs and small companies that are privately owned and lots of innovative entrepreneurs out there with new ideas. So it's never boring. We're unbiased. We don't run a diet program or a diet company ourselves, so we can tell it like it is. We have, we believe, more accurate forecasts than anyone else because we have more sources than anyone else, and we have more historical data going back 15 to 20 years. You can't look at this market just based on a 3 or 5 year trend. History tends to repeat itself. And we've looked at the market through recessions, expansions, bad weather, snowstorms, wars, consumer fads, fad diets, consumer shifting preferences, and much more. So for those reasons, I can confidently say that no other company or analyst in the US or on the planet knows more about the US weight loss market than Marketdata. With that said, let's get started. Okay, let's begin the teleseminar about new weight loss opportunities under Obamacare or the Affordable Care Act. Now, we believe that Obamacare is going to be a positive for certain types of weight loss services, mainly because there's something in it called the Preventive Care benefit. The Affordable Care Act stipulates that insurers must cover weight loss programs provided that they meet certain criteria starting January 1st, 2014. This presents an unprecedented opportunity for programs run by healthcare professionals that have a background in treating obesity and can provide counseling services. Now, not everyone can provide these counseling services. They have to be provided by a qualified weight loss professional. That means not just a person who went through Jenny Craig or Nutrisystem or Weight Watchers and successfully lost weight and was trained internally by the company, mainly in sales and customer service or order fulfillment, but someone who has a degree such as a nurse practitioner or a physician's assistant. The preventive healthcare benefit features are as follows. It provides a benefit of up to $1,625 per year paid by insurance companies. It pays for a physician's exam, a health risk assessment, laboratory tests, and lifestyle evaluation. It also pays for up to 14 counseling sessions within a 6-month period, and an extra 6 sessions if the person loses 3 kilograms or roughly 6 to 7 pounds of weight loss. It also covers Medicare patients. In slide number 5, we see that these counseling sessions must be by a qualified weight loss professional. So who is that? Who qualifies as a weight loss professional? A medical doctor, which could be a general practitioner, a family practitioner, an internist, or an OBGYN, a registered dietitian, a nurse practitioner, an RN, an LPN, or a physician's assistant, not health coaches, multi-level marketing distributors, psychologists, psychiatrists, or diet consultants. It has to be one of those 4 weight loss professionals. Moving on to slide number 6, client benefits. How does this benefit the person on the weight loss program? Well, it can be a regular food plan. It doesn't have to be a special diet food or a company diet food or supplements. It can be something like the DASH plan, which is a low sodium plan that is based on regular food for people with high blood pressure. Another benefit to the customer is that the customer basically pays $0 out of pocket, totally covered by insurance. Senior citizens would qualify. Prescription diet drugs can be prescribed if needed in such a program, and the person is going to get a higher quality of counseling than the typical commercial weight loss counselor. Moving on to slide number 7. What kind of business opportunity does this present? Well, healthcare and diet programs in general are going retail. You're seeing more and more diet programs being offered through things like CVS drugstores and Rite Aid drugstores with their mini clinics. And companies are reaching out to try and reach dieters where they shop, where they work, where they associate, where they spend their recreational time. And that's the trend lately, to reach dieters where they are instead of asking them to come to a weight loss center 2 or 3 times a week. So a physician's assistant or a nurse practitioner can set up their own practice now, specializing in weight loss. You can literally be your own boss with a guaranteed revenue stream and payment stream, because you know that the insurance companies, in most cases, have to pay. You're going to be able to offer a higher quality service at a lower price point than many of your competitors. So it's really a ground floor opportunity for people like physicians assistants and nurse practitioners to set up their own practice in weight loss with no revenue cap. The sky's really the limit in terms of revenues. Moving on to slide number 8. The stage has really been set by drugstore chains like CVS with their in-store minute clinics that now have a weight loss program with coaching. This CVS in-store program is based on the DASH diet, which is a regular food plan, regular grocery store food. It's a 6-month membership entailing 15 visits. It's a customized meal plan. And the costs are $122 for the first visit, $59 per each visit thereafter for the next 2 weeks. They're open 7 days a week. No appointment is necessary. So in terms of price, it's competitive with commercial and many medical weight loss programs. And the fact that they're open 7 days a week and you don't need an appointment, it's a lot more convenient than some of the weight loss programs out there now. So the stage has really been set by these drugstore chains. Rite Aid has its own program. CVS has its own program. It's only a matter of time, in our opinion, before Walgreens comes in with their own program. Moving on to slide number 9. What are the qualities of a good weight loss coach or consultant? Well, they should have a good knowledge of nutrition, exercise physiology, and medical conditions. They should be empathetic. They should be able to establish rapport with the customer and have been there themselves. Hopefully they've lost weight successfully. They've gone through roller coasters in their lives and stresses and maybe divorce, loss of a job, all kinds of things that would encourage people to overeat or not pursue good lifestyle habits and exercise on a regular basis. And so the weight loss coach or consultant has to be empathetic. They have to understand where people are coming from. It's probably crucial that they've lost weight successfully themselves and kept the weight off. They should also be consistent. They should be there through the whole program. One of the weak links of many commercial weight loss programs is that there's a lot of turnover amongst the weight loss coaches. They're not paid very highly. There's not much of a career path for weight loss counselors in most companies. And so they tend to stay for a couple of months, maybe 6 months, maybe 9 months, a year if they're lucky, and then move on to another job. So it's important to be there through the whole program and establish some consistency with the client for the program to be successful. They should also have the ability to motivate people and be personable and upbeat and able to establish rapport, as I mentioned before. So these are some of the qualities of a good weight loss coach. So in summary, there exists an unprecedented opportunity under this Affordable Care Act for people like nurse practitioners and physicians' assistants to get into this field, provide counseling for people that need to lose weight and do it well and get paid well for it and not have to worry about revenue stream, because this is something that's mandatory and insurance companies have to pay for under this act. Just a few reminders about market data reports and who they're used by, and contact information on this screen. You can contact me, call me, or email me at any time about any information in this teleseminar, and I'd be glad to help you. Thanks, and we hope that you'll tune in for some more market data webinars on a variety of weight loss topics. Thank you.